Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today I wanted to continue the discussion about hypothyroidism and oxidative stress. There's so much content last time, I needed to go back and kind of review that one more time. So in part one, we talked about when we have optimal cell health and optimal cell physiology, and especially optimal thyroid physiology in your cells make energy. That's what makes you feel good, feel alive, have lots of energy. And that's driven by T3. And part of that energy process is the production of waste material, right? Just like a fire creates energy, it also creates some smoke, which you have to address. Our cells have to deal with these waste products called free radicals or reactive oxygen species by either reducing them or clearing them and getting them out of the system. And that ability to get rid of these free radicals, these reactive oxygen species, is driven by thyroid hormone, T3 reaching the nucleus of the cell. So T3 helps you reduce free radicals and reactive oxygen species three primary ways: by increasing the activity and expression of something called UCP. This is the uncoupling protein, and that actually helps you dissipate some of the energy and drive it down a heat production pathway versus energy production. We want to make sure that we only produce as much energy as we can manage. The second way that thyroid hormone helps manage reactive oxygen species and free radicals is it increases the activity of the potassium ATP channels. So when our cells and our mitochondria are producing energy, they're pulling calcium into the cell and dumping potassium outside of the cell. And if we build up too much calcium inside the cell, that can become toxic. So as calcium starts to build and as energy starts to produce and these free radicals start to be generated, T3 increases the activity of these potassium ATP channels to let the calcium out, bring the potassium back in. It's a beautiful design. And the third thing that thyroid hormone does to help reduce free radicals and reactive oxygen species is to increase the activity and expression of antioxidants. And so we talked about these things got antioxidants kind of combat the free radicals being produced. Enzymes like SOD, catalase, glutathione, peroxidase. We talked about antioxidants like vitamin A and vitamin C and vitamin E, selenium, glutathione. All these things help reduce the oxidative stress, and they're all supported by your good old friend thyroid hormone T3. And so when we have hypothyroidism at the cellular level, cellular hypothyroidism is lack of T4 conversion to T3 or lack of T3 reaching the nucleus of the cells, then we have decreased clearance of these free radicals, and that produces increased oxidative stress, increases pathology, increases cell aging, and eventually causes disease. It is the accumulation of these free radicals and the stress that they create that actually causes us to have a lot of our hypothyroid symptoms. They're very similar to the symptoms associated with oxidative stress. So what do? If you have those symptoms of oxidative stress, brain fog, fatigue, headaches, muscle and joint aches and pains, decreased eyesight, increased blood pressure, increased cholesterol, all these signs of oxidative stress, what do? You want to, before you start loading the body with more and more antioxidants, you want to reduce the stressors that are creating the problem first. And stress on your body, beyond your body's ability to adapt, at the cellular level, whether it's physical, chemical, emotional, or microbial, triggers a drop in energy and what we call a cell danger response. The cell danger response, then part of that process is to down-regulate cell metabolism, and we see the deactivation of thyroid hormone. As we get the deactivation of thyroid hormone, decreased ability to clear the free radicals that are being produced, and we become more symptomatic, more toxic. So instead of taking those antioxidants, deal with these things. Take a look at your life. Do you have high levels of emotional stress, whether it's from relationships, work, your kids, your husband, whatever those things are? You have to deal with those. If you have chemical stress because of what you eat, what you drink, what you smoke, the medications you take, lots of factors, your environment, the quality of the air, these are all things that will drive a stress response, deactivate thyroid hormone, lead to increased free radicals, and make you not feel well. Do you have too much physical stress? Are you an endurance athlete or a runner or a biker or somebody who's always active and always exercising but not giving yourself the time to recover, repair, and regenerate? If that's the case, you need to address that. If you're a person who's underactive, you don't do much physical activity at all, that can be just as toxic and just as stressful as too much activity and exercise. And then we need to look at microbes. Do you have bacterial overgrowth, yeast overgrowth, viral overload? Do you have parasitic overload? These are things that can create cellular stress that can deactivate thyroid hormone, lead to increased reactive oxygen species, more damage to tissues, more cell aging, and more pathology and disease, okay? So look at your diet, look at your medication load, look at your home environment, your work environment. Look at your thoughts. What's going on between the 6 inches of your ears? Are you part of your own stress? What are you thinking about all the time? What are you saying to yourself all the time? What are your habits? Do you have habits that are more stressful or less stressful? Do you have things that help you heal, habits that help you heal and repair, or do you have habits that cause more destruction? Who's the group of people you hang around with? Are they positive people or more negative people? Always bitching, always complaining, spending too much time watching the news or complaining about other people on Facebook. If you are around a group of people who are the negative nillies, get rid of some of those people and get yourself centered around people who are more positive, more proactive, eat a better diet, are more physically active. What's your activity levels? Are you doing activities that are more destructive or more beneficial for your health? What's your sleep quality? Do you stay up too late? Do you get up too early? Do you not get good rest through the night? It's during the night that your body heals and repairs. It's during the night when you rest, you sleep, you recover. So if you don't have good sleep habits, you're not sleeping through the night, you need help for that, because it's hard to help your cellular physiology when you're not allowing your body to heal, rest, and recover. And what's your breathing like, especially at night? If you're a mouth breather, a snorer, I've talked about this on a couple Thyroid Thursdays, hypoxia created by abnormal breathing will create chronic stress. And that chronic stress will create thyroid hormone deactivation, which will again cause your body's decreased ability to get rid of these free radicals, these free reactive oxygen species. They will build up in your cells, damage your cells, create more damage. And you need to address your diet and lifestyle factors early on, because there just isn't enough medications and supplements to treat this process, and they will not fix these things. You have to address diet and lifestyle factors. So do those things first. I hope this helps. Look for, if you have any questions regarding this Thyroid Thursday or any, put them below wherever you watch the Thyroid Thursday videos, and look forward to more in the coming weeks. All right? Take care.